All right, gang, today we want to talk about sciatica. This has been a growing pandemic in our society. We're getting more and more patients with sciatica. So let's start with what is sciatica. And if we look at the spine, okay, your sciatic nerve starts in your lower spine, and it's that pain that runs down your leg. True definition is it runs down to your calf and foot. One of the longest nerves in your body, and man, it is painful. So we'll get patients coming in all the time that have sciatica, and they can hardly walk, they can't sit, it keeps them up at night, it's excruciating. Done a lot of other therapies, a lot of other pills, and they come in, and this is essentially a last resort, and they're like, I got to get out of this pain because it's agonizing, and I don't blame them. But when we slow down the train and take a look back and realize that this didn't happen overnight, okay? So these people want a quick relief, which is understandable because it's painful, but by the time you got sciatica, there's been damage to that lower spine. And what we'll find in an x-ray is people have lost the curve in the spine, the lower spine, and their pelvic girdle is tilting. It's rotating, and that's the cause of sciatica. Now, another term they use for sciatica is piriformis syndrome. So people will say, well, I think it's my muscle. It's only my muscle. It's not only the muscle, okay? It's not as simple as just taking a muscle relaxer. It may give you relief, but it's short term. This problem will present itself over and over again. A lot of times we'll find people that have had sciatica, have a history of low back problems, low back pain, and they've maybe had sciatica before. But to understand the piriformis muscle and where it attaches and where it comes through and it attaches to your leg, the sciatic nerve passes through the piriformis muscle, okay? So what happens is that muscle contracts and puts pressure on the sciatic nerve, all right? So a lot of times people go get a massage or they'll do some physical therapy, which physical therapy can help and give relief for this. But we have to ask ourselves, what's the cause of the problem? Is it because the muscle's short and we just need to release it? That will give relief. But again, it's temporary. So the quickest way to get relief and stay that way and now develop a strong structure to prevent sciatica in the future is to increase the integrity of the structure and take the pressure off the nerve and keep it that way. Now, if your spine is out of alignment or subluxated and that pelvis is tilted out of alignment, subluxated, putting pressure on all the discs in the low back, and it irritates the sciatic nerve, does it make sense to leave it that way? Your quickest way to take care of this problem is to see a chiropractor who knows what they're doing, and the first step is to get x-rays. You have to get x-rays to look at the structure. It can't be guesswork. I get it, someone could check your posture, they could feel around, they could understand the anatomy and see what's going on, but there's a lot of different variables that could take place within this structure that could be affecting that sciatica. And if you could correct the cause of the problem, your sciatica will get better, you will get relief, but now you will have a system to keep it that way. By increasing the integrity of your spine, increasing range of motion, increasing the integrity of movement and the pressure that those discs have on the nerves, hence the sciatica in this conversation, and through your lifetime, having a way to maintain that so you never have to go through this again. Because that's the key. It's one thing to treat something and feel good for the moment, but every time it happens means that more deterioration is going on, more arthritis is setting in. And as you get older, it's going to get tougher and tougher and tougher to overcome. And there's nothing worse than seeing someone who's 60 years old that's been working towards retirement, and now they get hit with sciatica, and it's their fourth, fifth time, and now they're begging for help because they have that cruise to go on vacation and they can't walk through the airport. And now that deterioration that manifested over 30 plus years, you can't get rid of it. And now you're just playing the relief game as much as possible. So let's find the cause of the problem. If it's not coming from the spine, that's a whole different story. If the problem's gone too far, you need surgery. That's a whole different story. But if you could go in and get a neurological scan and see how much stress that nervous system's under, take x-rays and see where the misalignments are that are putting pressure on that nerve and that structure, irritating the piriformis muscle, and you could get it corrected to take that pressure off and allow your body to take care of itself the quickest way possible to give you relief, keep it that way, and make you stronger in the long run, that makes more sense, and the results are phenomenal. We've taken care of thousands of patients with this problem, and they've done amazingly well, and you deserve the same.